This is not the first time you hear about the gastrointestinal tract. You have had a previous idea about it in year 1. Now, in year 3, we're going to expand your knowledge and we make it nearer to life. We start with the mouth. The idea is we start with simple idea and you make it bigger and bigger until it shines. So your brain should not contain lots of little ideas. It should contain as many as shining ideas. Because you treat people with good sound knowledge, with shiny ideas, with glowing ideas. Okay? So when you listen to a lecture, it is a little idea about the subject. You go and read your book, you go to the lab, you go to discussion, and then the idea gets larger and larger until it shines. Once it shines, you never forget it, and you can treat people with it. So we need to have shiny ideas in our brain. No spoon feeding. Don't come and say, you didn't say this in the lecture. I will tell you then that it's in the book. No spoon feeding. This image is disgusting when grown men feed each other with a spoon. It's not nice. It's disgusting. Why should I feed you with information? You feed yourself. And we need to go a few steps up towards achieving our goals. Our goal is to see patients, examine patients, and treat them. So we will go few steps. Doctors read books. This is a fact. Sooner or later, you are going to read books. Sooner or later. In the next few years, when you graduate, when you want to sit exams for specialties, when you want to go abroad, you need to read books. You're going to read books sooner or later. Doctors read books. Summaries and few papers will not make you a doctor. When you are young or when you are an old man like me, we need to read books. Books are not replaceable. Message received. So you go and read your Anatomy for Medical Students by Snell. Even very old doctors, they need to check their information from books. Now, when you are going to your summer course, beginning of year 4, you are going to have your introductory course in medicine. You start examining patients. First exam is opening mouth. Show me your tongue. This is a normal tongue. In the middle, and nice color. If the patient shows you such tongue, you're going to say, ha, there is anemia. Okay? So from the tongue you can learn lots of things. If the patient shows you such a tongue, this is fissured tongue. There is another problem. Some cases produce fissured tongue, like vitamin B deficiency. So you see how many things we learn from the flora of the mouth. This is what is called geographic tongue. It is also an indicative of some diseases. If you look at this image here, the side of the tongue, you see ugly thing. It's not nice. This is a tumor. So the mouth and the tongue has, each one has its own tumors. If the patient opens his or her mouth and you see this white patches, this is fungal infection. You will learn that this could be lower immunity for some reason, or taking antibiotics for a long time. You lower the immunity, you lower the bacterial flora, fungus will grow. These ulcers on the inside of the lip, I'm sure some of you had something like this, or sometimes which are very painful. See these two ulcers? These two ulcers are on the inside of the lip. It is in the vestibule of the mouth, and we need to know what structure, where's the disease, what structure is damaged. Then this angular stomatitis, angle of the lip gets sore and ulcerates. Again, what's wrong with this patient? You can see that there is a swelling in this side, on the left side, compared to the right. What structure is here, and is it related to the mouth? Okay. Again, this kid has a problem here, a swelling. This young man has a very obvious swelling in this area. What structure is affected, and is it related to the mouth? This old lady has some kind of a huge swelling under her ear. This is a normal mouth opened, and the mouth cavity is divided into two areas. The area between the teeth and the lips and the cheek is called the mouth vestibule. And then the cavity inside the arch of the teeth, this is the proper mouth cavity. And the tongue, this tongue here is elevated, and you can see there is a frenulum and a fimbriated fold for the sublingual salivary gland. The vestibule is is connected to the proper mouth cavity at the back, behind the third molar tooth. This is the lip, and this is the arch of the teeth, and the superior lip has a median frenulum. And this is the vestibule of the mouth, the upper part. The same situation is in the lower part of the vestibule. The vestibule, opposite the second molar tooth, has an opening for the parotid gland. This is a normal opening of parotid gland. Upper second molar. Upper second molar tooth, and the parotid gland opens into the vestibule. The tongue makes the floor of the mouth. The tongue it's a very muscular organ. It has intrinsic muscles and extrinsic muscles. Do you know what are the extrinsic and intrinsic muscles of the tongue? The tongue has 3 sets of intrinsic muscles. Longitudinal ones, when they contract, they make the tongue short and ball-like. And it has transverse intrinsic muscles, and when they contract, they make it long and protruding, and perpendicular, they make it flat and wide. And the surface has, which is a stratified squamous epithelium, has little elevations called taste buds. You can see these little papillae. These are taste buds. And there's sulcus terminalis, the joint between anterior 2/3 and posterior 1/3 of the tongue. These are called valid papillae. These are not pathology. You can see when they are nice and well arranged, they are normal. Pathology is ugly. These are the valid papillae. This is the tongue elevated, and you can see the frenulum. You can see the fimbriated folds with veins. This is the place of sublingual salivary gland. And at the base of the frenulum, there are 2 openings for submandibular salivary gland. The parotid gland opens here. The submandibular glands open at the base of the frenulum, and the sublingual, they open through 8 to 20 separate openings. Contraction of longitudinal muscle produce such shape of a tongue. In this sagittal section, you can see that here is the tongue, and what we see of the tongue is only the anterior 2/3. Posterior 1/3 is in the oropharynx. The roof of the mouth is hard palate. The soft palate is a movable structure that closes the nasopharynx and then goes up. When it comes down, it opens the nasopharynx to the rest of the pharynx. It's not really the roof of the mouth. This is the roof of the mouth, the hard palate, which has corrugations. This is it's called a mucoperiosteal kind of mucous membrane. This is something you know from your study of the skull. what makes the hard palate. Palatine process of maxilla and horizontal plate of palatine bone. This is kind of soft, normal soft palate where you can see the uvula and space behind the uvula is the oropharynx. This is a common problem. This is pharyngitis. It's an inflammation because it's red and you can see spots of pus formation. This is a common complaint that makes swallowing very painful. Here the tongue is depressed and the space that at the end of the mouth that opens into the oropharynx is called fauces. And this is one constituent of the soft palate, which is called palatoglossus. The second one is called palatopharyngeus. And between them is the tonsillar fossa. This person has small tonsils. And lots of people have problems with tonsils and they get larger. Therefore, you can see only the palatoglossus, and the tonsillar fossa is filled with large tonsils, and the space between these two tonsils is called the fauces. Soft palate has its own problems. This person has a problem with the vagus nerve. So when he or she say ah, soft palate shifts to one side. We will have explanation of this in neuroscience too. When you stand in front of a mirror and you open your mouth, you see the posterior wall of the oropharynx. It has rounded white swellings. These are lymphoid tissue collections, and it is shiny, and this space is the oropharynx, posterior to the wall. Let's see what's wrong with this person. What structure is producing this swelling? It is the parotid gland. Parotid gland. Where is the parotid gland? It's in front of the ear, in front and inferior, and you can see that the facial nerve is coming out of parotid gland. In fact, it divides parotid gland into superficial and deep. So it is very important. It puts the facial nerve in jeopardy, in danger. And if you see that here is the mandible, part of the parotid gland is below the margin of the mandible. And that is a problem, because if you have a swelling here, you will miss it as a lymph node or submandibular gland, while it is part of the parotid. So we have to be careful, and we need to know that part of the parotid is below the angle of the mandible. Here's a dissection of facial nerve as it comes from stylomastoid foramen, and this is the superficial part of the parotid gland, and you can see that the facial nerve is passing through the parotid gland. This is a diagram showing the facial nerve and the parotid gland. Here is a parotid gland tumor. When there is a tumor or there is a problem in the parotid gland, it hits the facial nerve, and the result is facial palsy. So when you read anatomy of the parotid gland, you will come across what? Facial nerve. And you need to know what is the relation of facial nerve to parotid gland, because you will see patients with this relation in Japan. This is a colored parotid gland, and I've drawn this line as the margin of the mandible, and then this little part below the margin of the mandible. We have to take care of, or we should know that this is an extension of the parotid gland. This is a problem in that extension. This is a problem in that extension. The parotid gland has a salivary gland. It has its own capsule plus another capsule from the deep investing fascia of the neck. Swelling of the parotid is very painful. When the baby has parotitis or mumps, he or she, they scream. They cannot sleep because it's very painful. The gland wants to expand and the two fascia are not allowing it to, so the case becomes very painful. This is called Stensen's duct. It is below. We need to palpate this duct. It is on the masseter muscle and 1 finger breadth from the zygomatic arch. It is palpable and it is going to pierce this muscle. This muscle is the buccinator, and as it pierces this muscle, it's going to open in the mouth, opposite the upper second molar, in an oblique way, so that when you blow air, air will not go into the gland. That's the buccinator. This is the opening of parotid gland. This is an opening of the parotid gland with pus coming out of it because of inflammation of the parotid. Sometimes the secretions produce stones, calculi in the parotid gland, and we need to do what's called a cyanogram. We open the mouth and we put a little cannula into the duct, because we know where's the duct, where's the opening of the duct, and you inject a radio-opaque material, and this is what you see. You inject the dye here, and you can see these are the ramifications, the branches of the ducts of the parotid, and this is Stensen's duct. This is called a cyanogram. This is a normal one. This diagram, drawings, we're going to use drawings as little as possible. We want to see the real thing, the real life. It shows you the opening of the parotid gland. The next, submandibular gland, salivary gland. It is in what's called the submandibular triangle. What makes the submandibular triangle is the lower margin of the mandible and the two bellies of the digastric. It has several contents. One of them is submandibular salivary gland. Here is a drawing of the submandibular salivary gland. It is strange because if the floor of the mouth, made by mylohyoid muscle, is a superficial part and then curves and continuously forming the deep part or the part inside the mouth. So it has a part outside the mouth and a part inside the mouth. The part outside the mouth is larger, and the duct comes from the part inside the mouth. Here's a swelling of lower part of the jaw. This is the margin of the mandible and the digastric muscle. This is anterior belly and this is posterior belly. And this is very likely to be swelling of submandibular salivary gland. Again, this is likely to be a swelling of submandibular salivary gland. In this cadaver, we can see that this is the lower margin of the mandible. This is the digastric muscle, posterior belly. And this is the anterior belly. You can see arteries, veins, and nerves, and this is the superficial part of submandibular salivary gland. Submandibular salivary gland has important relations with arteries and veins. The most important one is the facial artery. Facial artery, as it comes from the external carotid, is the common carotid, external carotid. One of the branches of the external carotid is facial artery. So the facial artery is posterior, has a tortuous course, and it makes a groove on the submandibular gland and appears in front of the masseter. So when you play around with submandibular, remember there is a big artery called facial artery. This is a color diagram of the superficial part of submandibular gland and the Stenson duct of the carotid. Here's a diagram showing the superficial part of the submandibular gland, and then this is the mylohyoid muscle, inferior to the tongue, and then the deep part of the submandibular gland. This is the sublingual gland. It's in the tongue. So this is the floor of the mouth. This is the superficial part of the submandibular gland, and turns around and gets into the mouth as the deep part. This is a colored submandibular gland where it shows that the superficial part is much larger than the deep part, and that's the mylohyoid muscle, and the duct comes out of the deep part and opens at the base of the frenulum of the tongue. There's an important relation here. This lingual nerve hooks around the duct of the submandibular. It's called the Wharton's duct. If you play around here, remember, don't cut the nerve. That's the lingual nerve. That's the duct. And this is the large nerve supplying the tongue. You will read that the surface of these salivary glands is lobulated. It's not smooth, it is lobulated. And the big problem is that they have lymph nodes on top of them. So if you have a little swelling, you are not sure whether this is a lymph node or a part of the gland. and this is a dilemma that you have to solve. That's the superficial part. These are the submandibular lymph nodes. These are important lymph nodes because they drain lots of parts of the superficial part of the face and the deep part of the mouth and the pharynx. And they are sitting on top of submandibular salivary gland. The gland is lobulated, and these are on top of the gland, which makes it more lobulated. These are the submandibular salivary glands that we have to take care when we examine the submandibular. They drain parts of the face and even other lymph nodes like the parotid and the submental. This is the Wharton's duct. This is the relation between the nerve and the duct. This is the frenulum of the tongue, and there's this opening of submandibular salivary gland, and there's the other one. This one has a problem. It has a problem. A stone. Saliva has a special composition. The physiologist will tell you about the composition of the saliva. And in some people, this saliva in the gland or in the duct produces stones, calculi. And these calculi, they block passages. And they have to be taken out, otherwise the gland will swell. Swelling the gland is painful. So you need to know how to take this stone out. This is a cyanogram. You inject a radio-opaque material from the opening at the base of the frenulum, and this is the duct, Wharton's duct, and you can see that the duct, this dye has visualized a rather large submandibular gland. Here is an inflammation where you injected the dye into Wharton's duct, and then very little passed into the gland, and when you visualize it with an X-ray, you don't see things like this. So this is a stricture, this is a problem. These are special views of the cyanogram of submandibular salivary gland. The sublingual is on the inferior surface of the tongue, and it has many openings and many ducts, 8 to 20. So it doesn't have a single duct. And it is going to be present here, at the base of the tongue. You can see that this is the fibrated fold of the tongue with visible veins. And if you compare it to the left side, there is a problem in the left side. It is different from the right. This is a tumor of sublingual salivary gland. In medicine, we always compare two sides. We always compare two sides. Thank you. Now, I have mind maps mind maps of the parotid. I'm going to put them on e-learning. Let's go through this mind map. Okay? An overview, it is the largest salivary gland and it is lobulated. Is this important to say that it is lobulated? The answer is yes. If it gets smooth, then it's either distended or it has a problem. The shape is pyramidal. You can see that a pyramid has an apex and a base. The apex is inferior, it is inferior to the margin of the mandible. Why do I have this bump here? Danger. We have just explained this, right? The superior is the base and it is inferior to external auditory meatus. Now, when it is inferior to external auditory meatus, at the beginning, the patient will come and say what? When I open my mouth, I have pain in the ear. Or without opening the mouth, I have pain in the ear. You examine, you send your patient to the ear, nose and throat person and examines the ear and says, there is no problem. There is no problem. We'll go and examine parotid gland. Go and examine the parotid gland. Capsules. It is not capsule. It is capsules. On capsule plus extra one from the deep investing fascia of the neck. And this piece of information is the basis of parotitis or mumps. Is painful. Children are usually affected and they cry all night. And they cry all night. Now at the beginning, this kid is going to cry first night and then the second night, and the mother will bring the kid to you. Examine the parotid, right? Do physical examination and examine the parotid. It is very painful. Now, surfaces, the superior surface has a process that has posterior to the TM joint, temporomandibular joint. It goes behind temporomandibular joint, and there is facial process, and sometimes the gland has an accessory lobule. شو المهم بالتليفون هذا؟ Okay. And there's a deep process medial to the pterygoid muscles called pterygoid process. It's a little extension. The duct, we have talked about the duct. Structures passing through the gland, facial nerve divides the gland into superficial and deep part. Then lymph nodes, external carotid artery, retromandibular vein. Okay. Nerve supply. Salivary glands, they need sympathetic and parasympathetic. Sympathetic will produce thick secretions. Parasympathetic will produce watery secretions. So, when you sit in the exam and you have dry mouth, you have increased sympathetic activity, right? Why should football players always spit? ليش لاعبين الكرة بيبزقوا دائما؟ يعني they are concentrating very much. Sympathetic activity is high, and salivary secretions is thick, and it's not nice to have thick secretions in your mouth. So they do what? They spit it. A normal person when spits, it's antisocial, right? It's antisocial. But a football is allowed to do that. It's allowed to do that. Right? Put this into the e-learning. The tongue. Now we have talked about the tongue, parts of the tongue, the mucous membrane. We are not really concerned about taste buds. Nobody is going to come to you and say, I cannot feel salt. People have spent 40, 50 years in medicine and never received a complaint saying, look, I cannot feel salt. So it's not really important thing to bother about. These are the intrinsic muscles and the extrinsic muscles, and the deviated tongue we will be talking about in neuroscience too, when the hypoglossal nerve is affected. Okay? Thank you very much.